Hello class, my name is Bree Pitkin. This presentation is regarding solitary confinement and the negative effects that it has on the mental health of prisoners in the United States. The primary concern with the use of solitary confinement is the harmful effects that solitary confinement has on an individual's mental health. Much of the research that was examined indicated that there are higher rates of psychological distress among prisoners who are subjected to solitary confinement than in prisoners who are not. The duration of time that individuals are exposed to solitary confinement, coupled with the conditions of the solitary confinement, are driving factors of how severely solitary confinement can negatively impact a prisoner's mental health. Extended periods of isolation in solitary confinement detrimentally impact a prisoner's mental health. The visual here in the middle is from 2016, and it is a report that shows how many prisoners have been subjected to prolonged instances of solitary confinement in the United States. Conditions of solitary confinement, such as long periods of perceptual isolation, social seclusion, and involuntary idleness, can lead to various symptoms of mental illness, including but are not limited to obsessive thoughts, paranoia, depression, insomnia, anxiety, impulse control issues, hypersensitivity, and psychosis. Data collected by researchers examining the prevalence of mental illness in prisoners who had experienced solitary confinement found that about half of the prisoners examined had significant signs of mental distress. Furthermore, the mental health consequences of solitary confinement have been found to extend after solitary confinement was concluded. This is indicating that the effects are long-lasting. Data collected by researchers mentioned previously indicated that after being subjected to solitary confinement, 19% of prisoners were diagnosed with a serious mental illness, 18% had engaged in self-harm, and 22% had attempted suicide at least one time. In addition to the risk of development of mental illnesses as a result of solitary confinement, research shows that symptoms of severe mental illnesses are exacerbated in prisoners who are subjected to solitary confinement. Solitary confinement is oftentimes used by correctional officers as a way to quell the outbursts of a prisoner who is showing symptoms of severe mental illness. While this action may help the correctional officers maintain order within the prison, it ultimately harms the prisoner who is experiencing symptoms of severe mental illness. When prisoners who have severe mental illnesses are placed in solitary confinement, symptoms of schizophrenia, bipolar, major depressive, and paranoid disorders are heightened due to the isolation and lack of adequate mental health care. Much of the research indicated that the aggravation of mental illnesses due to solitary confinement is largely caused by inadequate mental health treatment in prisons. We can move on to policy implications now. States like Colorado introduced a ban on solitary confinement for individuals who are disabled, pregnant, have SMIs, and are underage. North Dakota implemented a policy that requires correctional officers to converse twice a day with prisoners in solitary confinement, and New Jersey passed legislation that requires that solitary confinement be restricted to 20 consecutive days. The overall goal of these policies are to lessen the negative mental health effects that solitary confinement can have on prisoners. The policy that is in place in Colorado specifically aims to keep especially vulnerable populations out of solitary confinement. Policy in North Dakota was implemented to lessen the sense of isolation that prisoners in solitary confinement commonly experience. The New Jersey legislation is an attempt to thwart the negative effects that prolonged solitary confinement has on the psyche. Moving on to the need for change section. Due to these findings, policymakers must implement restrictions on the use of solitary confinement in correctional facilities in the United States. Some restrictions could be the abolishment of solitary confinement altogether. It would be ideal for policymakers to restrict the use of solitary confinement in correctional facilities ideally. In place of solitary confinement, prisoners experiencing outbursts would be sent to facilities run by social workers who are specially trained in de-escalation in order to properly aid the prisoner. And if the prisoner is experiencing symptoms of mental illnesses, they would receive care in a mental health facility that can give adequate therapy and medication treatment as needed. While it is hopeful to eliminate the practice of solitary confinement altogether, in the meantime, it is realistic for policymakers to impose policy that improves the conditions of solitary confinement. Because the research indicates that prolonged exposure to solitary confinement can create severe psychological distress, policymakers should restrict the time that a prisoner is allowed to be subjected to solitary confinement. Additionally, research indicated that poor conditions within prisons exacerbate negative mental health effects associated with solitary confinement. Increasing funding to help prisons improve the conditions may help lessen the negative effects solitary confinement can have on a prisoner's mental health. Lastly, research indicates that prisons are not the ideal place to treat those with SMIs, and because of this, individuals with SMIs should be sent to mental health treatment facilities to receive adequate care. To conclude this presentation, the research findings indicate that solitary confinement has extremely negative effects on a prisoner's mental health. Corrections must be made to the criminal justice system, and the use of solitary confinement must be heavily restricted and ideally abolished.